Hello and welcome to another episode of Discover with Sbenati. Today we have an amazing guest. As usual, we only bring on amazing guests. And today is absolutely no exception. We have Ashley Guruk. Did I say it right?
Gulka.
Gulka. I'm so sorry. I butchered her name. It's because in my mind it's Ashley Francis, but that's her middle name.
We can call me Ashley Francis too.
Ashley Francis. So Ashley is an RMT, a registered massage therapist, and she is or has been in the business for the past 10 years. So she knows one or two things about massage therapy, and she's here today to tell us a few things to watch out for, who to pick in terms of your massage therapist, what to look for, what kind of massage therapy that you should get, and what this massage therapy does do for you. So thank you for tuning in. For those that are tuning in to the YouTube, for those tuning in to the podcast as you're walking your dog and going to the gym or doing whatever you're doing, thank you for tuning in. We really appreciate it. Without any further ado, we are here with our lovely
Ashley Francis.
Ashley Francis.
Well, Ashley Gulka.
Ashley Gulka. Okay, so Ashley.
Yes.
So let's start from the top. So what does a massage therapy entail?
Oh my gosh, so many different things. You know, a lot of people think that it's just like a frou-frou, you know, nice thing to do for yourself, and it is. It feels great. It's really good for relaxation, for promoting relaxation. But, you know, it's basically just manipulation of the soft tissues in the body, and helping to obtain myofascial release. And I can get in a little bit more as to what fascia is and how important that system is in our bodies. But so it promotes, you know, health and wellness and healing kind of from the inside out.
Okay.
Yeah.
So why don't you go into the whole muscle fascia?
The myofascia? Yeah.
Myofascia.
So your fascia is...
I should have known that because I studied that myself.
is
But yeah, myofascia, go ahead.
So it's everywhere in our bodies. It's kind of like our internal clothing layer. It kind of looks like balled up dental floss in a sense. And it's one of the only systems that touches all other systems in the body. So it's everywhere, right? It's in between our muscles, our bones. It's throughout the circulatory system, the nervous system, the skeletal system. So it's so crazy how when our fascia is affected and there are restrictions in the fascia, it inhibits our kinetic chains of movement, or the way that we move, right?
Yeah.
So when we're inhibiting our natural kinetic chains of movement, we're building different types of compensation patterns that develop over time, right? And then eventually those compensation patterns will start to have like repetitive wear and tear.
Right.
Where
Are you talking about like limping on one side,
yeah,
or bad posture?
And sometimes it can just be something as simple as a little bit of restriction in your range of motion, say in your shoulder. Like you're noticing you're not able to, you know, kind of get the range that you once used to. So getting regular massage therapy can really help with address those myofascial restrictions. And then in turn, we can get deeper into the tissue. There's different layers of muscle tissue that can kind of build up those compensation patterns, and then therefore where we have issues in our body. So yeah, so it really helps with the release of that.
Okay.
Plus it promotes circulation.
Okay.
Right?
Right.
We're affecting the
Throughout
circulatory
the
system.
spectrum,
Yeah. Always. A lot of our strokes are performed towards the heart, just to help promote healthy circulation.
Okay.
What else? We affect the lymph system, so we kind of get the lymph fluid, you know, moving, circulate the lactic acid buildup out of the tissue. Try and get the cortisol, which is a stress hormone, get that, because that's held in muscle tissue as well. And when those things are kind of building up, it can cause soreness, muscle fatigue, and that's when the body starts screaming at you.
And it can affect your mood, of course.
Oh, 100%.
Right?
When think about it, when you're not feeling great, when you have, you know, pain in your body, that really wears on your energy levels. Right? And your mindset, and everything is just not working properly.
Right. So massage therapy isn't just for athletes.
No.
It's for
everyone.
Everyone.
Yep. I think my youngest patient is 6, maybe. And you know,
6 years old?
Yes.
Oh. Okay.
Yes, I know, crazy, right? But I just love how we're getting the word out there that massage is good for, you know, people of all ages, all different like health statuses. Really great for post-surgery, you know, postpartum, prenatal, geriatric massage. There's so many benefits for anyone.
Okay. So what's specifically for that 6-year-old? What benefits could that 6-year-old? Because
Oh
I mean,
my gosh.
people that are children that are really
Yeah.
young, they're very resilient. Like
Yeah.
their muscles aren't so tight.
But think about how quickly they're growing.
Yeah.
Okay. That can sometimes cause, I don't know if you ever remember growing up having growing pains,
That's right.
specifically in the
knees,
leg.
That's right.
I just remember that so vividly. Oh, it was so brutal. Anyways, so the massage can really help with that soreness and that fatigue. Because think about, gosh, when we're growing, our muscles and our bones are growing at such a rapid rate. Of course, there's probably going to be some soreness and because the tissue is stretching, right? So the massage can really help with that, you know, those little growing pains, especially if kids are active, right? Like if they're doing gymnastics or, you know, competitive swimming or diving or karate, different things like that.
Right.
Those joints, the muscle tissue, the bones, like they're all going to be affected eventually, right?
And how many sessions do you provide for that 6-year-old?
She only comes for maintenance. I'd say, you know, there's nothing major going on, but once every couple of months.
Okay.
Yep.
Once every couple of months.
Yep.
Okay. And that's what, indefinite, or is there like a specific treatment?
It's just as long as she feels she needs it and it's benefiting her in her sport.
Okay.
Which massage can really help with that as well, like performance. But yeah, you know, it's not one of those things like once you start, you have to keep going.
Right.
But what I will say is if you've never had it and you start going on a, you know, regular, semi-regular basis, and then you stop going for a while, that's when you really notice. You know, it's like, oh, wow, yep, okay.
You notice what, soreness or
maybe
performance?
that was doing something,
Okay.
you know,
Okay.
when you stop going, when you're going regularly and then you stop for a while. Yeah.
So for runners or for weightlifters or for like people that are super active, that would affect their level of output?
Yes, so it can really help with recovery, right? Muscle recovery. It can really help with injury prevention, right? When people come for massage, I really like to focus on patient education, you know, just because knowledge is power. And I find that mind-body connection that people are obtaining through going for regular massage can really help with performance, right? Being more in tune with your body, what's going on, how it's feeling, how you can maybe tweak some things in your daily routine to help negate any kind of you know, muscle soreness or fatigue or overuse stuff.
And you provide that kind of guidance?
Yes.
Oh, wow.
Yeah.
Okay.
Yeah. Because, I mean, the key, I mean, I can only do so much, right? People aren't, it's not like they can come for massages every day or every week even. So what they do between the appointment times of seeing me is what really is going to make a big difference.
Right.
I can give tools, I can start to facilitate healing. But like I said, it's the key is a lot of the times what people are doing in between those massages.
So give me an example. So say for instance you have a weightlifter who's really sore and he wants to lift more, but he thinks that it's because his muscles are really, really tense, that he is not growing fast enough. So what can you provide him in terms of, walk me through the journey. So he's coming to see you and he's going to get a massage. What should he pick? What massage should he pick? What's the massage going to do, and what should he do after that between this massage and the next one?
Right. So, you know, the first treatment is always like an assessment, right? We do the initial patient interview, go through the health history, figure out, you know, what's going on. There are certain questions in the health history form that can kind of get my brain thinking as far as like what might be causing what's going on, such as, you know, what do you do for a living? What's your occupation? How often are you exercising? What types of exercising are you doing? Those types of questions, so that right in that client interview process, I'm starting to, you know, gather information in order to get a picture as to what is going on. So then there are some functional tests that can be performed depending on the issue. And then from there, it's basically, you know, the best way for me to really figure out what's going on is the hands-on part of the treatment, where it's like me getting to know what's, your spots of irritation, aggravation, and then based on like the interview and those initial strokes, I can kind of gauge maybe what that massage should be. So people can come in and request like a deep tissue or just like a general relaxation massage, but sometimes, a lot of the time actually, what I do find is people come in with an idea in their head as to what they want, but that's not in fact what they end up needing or benefiting from. So it really is important to just, do that really good health history and initial, interview to get a better idea as to what's going on. And then from there, your practitioner should be able to tell you, me, Ashley, where we should kind of go from there, and what's the best route for them. But yeah, good communication though, like making sure that I feel like their needs are being met at the same time, even if it's not what they quite wanted or, initially asked for, just making sure that they're okay with trying different modalities during the treatment.
And so how long does someone go in for a massage then?
Usually, I'd say the norm is about an hour, but we can do anywhere from, I can do anywhere from 30 minutes to 2.5 hours, depending on, what's going on, what people want, what people need. Yeah.
And you don't get tired?
No.
I mean, you've been doing it for 10 years.
I know.
So
yeah. It's funny. I remember when I first started that initial student clinic. So I think I had like three clients or something like that. Oh my gosh, at the end of that shift, I was so dead.
Yeah.
I was so sore.
Yeah, I was going to say, exactly.
My wrists,
Right.
my hands,
right.
Even my legs. I remember the tops of my legs. So,
so you need a massage?
Well, yes, I do. I really, really do.
Yeah.
I should be getting them a lot more than I do.
Okay,
But yeah. So, I don't remember where I was.
Yeah, so you got really sore.
Oh, yeah.
Yep.
So a lot of what we do, a lot of the power, the deep power, comes from the lower parts of our bodies because that's where all the power muscles are, right? That's where all those large, strong muscle groups are.
Right.
So in school, they really focus on our posture and positioning while we treat because that's what's going to, provide longevity in this career is when you're smart about your body mechanics while you're treating, right? And
same thing with dentistry, by the way.
Exactly, and that's why I knew you'd know what I was talking about because I do have some friends in the industry. But and B, it's going to help with the wear and tear on our bodies as practitioners, right? If we're doing things properly. So, but that first clinic, that's really what I was like. Whoa, yeah, those muscles were working, even though you don't think that they would be, but yeah, they do.
Okay, but now you don't feel that anymore because
No.
you've been doing it for so long.
Yeah.
Okay.
Yeah.
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 Do you have can you arm wrestle someone?
You know what? So funny. My grip strength is actually I'm working on that right now because it's actually gotten weaker.
Oh.
Yeah.
Over time?
Yeah.
Huh.
Yeah.
Okay.
My wrist and my grip strength is weak, but I can give a good deep massage.
I'm pretty sure.
Yeah.
Pretty sure. Okay, so back to the journey. So this athlete comes to you, says, I want deep tissue.
Yeah.
And you're like, okay, we'll fill this out. We'll talk about what's going
Yeah.
on, and then we'll get the assessment started.
Right.
And then at what point do you tell them, okay, well, I think deep tissue isn't really what you need right now. I think what you need is this.
During the treatment.
Okay, during the treatment.
Yeah, during
Okay.
the treatment, I'll kind of, like I said, communication is key. I always like to tell my clients that it's very important to feel comfortable in that communicating because that's what's going to create an even better experience.
Right.
Right. So yeah, during the treatment, if I feel like maybe the muscles weren't ready for a deep tissue massage at that point. Because they're not responding, say, as quickly as I would like them to. And you really need to get things to release kind of layer by layer in order to get deep. And sometimes the muscle tissue isn't ready for that. So, once it's been a little bit into the treatment, if I don't feel like it's the correct thing, then I'll, just say like, listen, I'm having a hard time getting the muscle to respond as quickly as I would like it to. I think that maybe you would benefit, like I'll, go as deep as I can, but I'll meet the muscle's resistance and then I won't take it much further than that because that's where you can damage tissue and you don't want to do that. A lot of people think no pain, no gain for massage. That's personally not my motto.
Okay.
I've had great client outcomes without having to put people in immense amounts of pain and discomfort.
Okay.
Because if you think about when you're in pain or when you're uncomfortable, what do? You tense up.
Tense up, right.
Very counterproductive to what we're trying to do,
Right.
right? So there is a good working maximum on a pain scale, and I will go over that with my clients in the beginning. But yeah, so we would just kind of do the treatment as, take it as it comes.
Right.
And then afterwards, once they're up and off the table, that's when I will go over any kind of remedial exercise, such as stretching or strengthening, or like little minor things that they can do in their daily routine. Like even something as simple as bending over and switching the laundry from the washer to the dryer.
Right.
You shouldn't be hinging at the hip. Right. You should really focus on bending, bending your legs and like almost getting down into like a squat position if you can, and keeping that back straight. Because when we go into that hip flexion, right, that flex position of the torso, it does some crazy things.
Of course.
Yeah.
Of course, that's how people tear their back. Yeah.
Yeah. So just
true.
like telling them to be mindful of, different postural things and obviously drinking lots of water. It's crazy how many people don't drink enough water in a day.
Yeah.
But it's hard when
Yes.
with sometimes with what we do for work, right? And I get that, but so
then after that, okay, so then he goes or she goes home.
Yep.
How often should they see you then?
It depends on if there is an acute issue going on. So if there's something that we need, that time is of the essence, that we need to get ahead of it, say something is, for instance, I had someone, she was needing to maybe get carpal tunnel surgery, or she was going to see a doctor. And in the meantime, I said, well, this issue hasn't been going on that long. Why don't, while you're waiting for your appointment, we get you coming in. I want to see you like 4 times, right close together. And I do find something really magical about those 4 treatments closer together that really shows if what we're doing is working, right? If the muscles are willing to respond. And then at that point, if we're not making as much headway as I had wanted, then we'll kind of go back, reassess, and figure out where to go from there. So if there's an acute issue, I say like once a week for 4 weeks, and then we do a quick reassessment, and then proceed, as we must. If it's just for maintenance, I tell people, it's such an individual choice, but I say anywhere from 4 to 8 weeks, depending on the person. Some people like to just come once a month. Some people come once every 6 months or 6 weeks. Some come every 8 weeks. It depends.
Okay.
Yeah.
Now, okay, that's really cool. And I really like the way you approach. I really do, because my experience of massage therapy is you walk into a massage parlor. That's what they're called, right?
No.
Okay. Massage
clinic. Yeah.
Okay, so massage parlor is something else.
Very taboo.
Okay.
We don't go there.
So you go into a massage parlor. So you go into a massage clinic, and usually they give you like, if you want deep tissue, it's this much for this long.
Yeah.
Stop laughing, bro. If you want whatever, relaxation, whatever, the different kinds of categories. To me, I just focus on, I'm the no pain, no gain guy.
Yeah.
So to me, I'm like, give me the most pain possible,
Right.
and I'll get the best benefit.
Yeah. Oh.
So I really like your approach, because it's kind of like, well, you're coming from a very uneducated perspective. Let me give you what I think you need based on your history and based on your condition.
Correct.
Right, which is very personalized, and actually I've never seen that before.
Really?
So yeah, so that's awesome.
Yeah.
Now, can someone say, I don't need massage, I can just stretch? Can they substitute stretching for massage?
Oh man. In a sense, yes, but in a sense, no at the same time. So stretching is great, and I am everyone should be stretching a lot, because that's what's going to keep us mobile in life for longer, right? And it's so important post-activity, especially. But no, it's if there's no, probably not. There's always stuff going on, right? Okay, and someone can feel great, but I do find a lot of times someone will come in and they'll say, oh yeah, like I'm, everything's been feeling good, and I've been stretching, and I've been really active and moving a lot lately, and everything's feeling good. So just kind of here for relaxation, whatever, more often than not, I find something. Because our bodies have a great, just, some tender spots or some irritation and some attachment points, different places. Everyone holds stress differently as well. So sometimes people don't even realize that they're holding things that, and then it comes out during the treatment. Right. So, as far as like the hands-on manipulation of the tissues, I mean, not much can really replace that,
Right.
Yeah.
Okay. So the strict answer is technically no.
Yeah.
Okay, but stretching does help.
Stretching is amazing.
And everyone should be stretching.
Everyone should be stretching.
Every day?
If you can, yeah.
Okay.
I mean,
what's your advice?
Start with 3 days a week. If it's not a part of your routine at all, stretching 3 days a week. If you're active, like if you're doing a workout, an intense workout, any kind of, sport or anything like that, stretch post-activity.
Okay.
Warming up, stretching is very important. That dynamic stretching before activity. Yep. But it's that static stretch, right? That stretch where you're holding the position for at least 30 seconds to really get the muscle to lengthen out for you after it's been working so hard. Mm-hmm. That's what's really going to make a difference with your mobility. It's going to make a difference with injury prevention. It's going to help with recovery and soreness. So stretching post-activity, always. So if you're doing activity every day, then yes, definitely.
And the faster you recover, the more you can do.
Yes, which then in turn, and I mean, think about it. If things are moving better, right? If your range of motion is improving, if your mobility is improving, then that's just going to help with your performance in whatever it is that you're doing. Whether even if it's just just working out at the gym, it's going to really, really help with performance. Yeah. Okay.
And how, what should be the length of the session of the stretch? Should it be 10 minutes, 20 minutes, 5 minutes?
I mean, I think ideally to do a good full body stretch, really, really stretching in and addressing every muscle group, at least 10 minutes. Okay. At the very least, yeah. Okay. But longer is always better too.
And what's the best, if someone had no time to stretch, but they had just one stretch that they could do, what stretch would you recommend your clients to do?
Oh gosh, that's such a hard one. Oh, there's too many.
Someone's tied with time.
I guess it would depend on the activity. So say if it was leg day at the gym, or someone was just doing a lot of elliptical or the Stairmaster or something like that. You're gonna want to focus from the waist down, right? So, gosh, just one stretch to do for that. I'd say if anything, it would just be to stretch out your posterior chain. So that's going to be your hamstrings, your glutes, your calves, and your low back.
So basically standing tall and then touching your toes, bending down, touching your toes?
Correct, with a slight bend in the knee.
A slight bend in the knee. So never go straight. Never go deadlock on the knee.
I would keep a soft knee. Okay. Yeah, there's different ways you can stretch the posterior muscles to isolate each different muscle group. But as a generalized stretch, I would say, keep those legs soft. Okay. Yeah.
So if there's one stretch, it would be that one.
I suppose, yes. That's such a tough question. Anyways.
I'm trying to narrow it down for people that are super busy. Yep. People want to get into stretching, but they don't know where to start. You start off with something small, something that's really effective. So that's why to me, I'm I want to start stretching. Yeah. I'm not a stretcher.
So if you're holding your stretch for 30 seconds, so there's no reason why you can't take 5 minutes at the end of your workout. Because if you think about, there's different stretches for different muscle groups, but if you're stretching, 4 or 5 muscle groups at 30 seconds each, I mean, that's more than enough. 5 minutes is more than enough time to focus on the lower part of the body. Okay. There's different ones you can do for upper body too, but 5 minutes.
5 minutes.
That doesn't take long.
No. 5 minutes.
5 minutes.
That's it. Okay, cool.
Yeah.
All right, cool. So you've answered my questions, and so now if someone wants to get a hold of you,
yes,
how can they get a hold of you?
So you can find me on Facebook. It's Ashley Gulka RMT. It's a business page, so you can message me on there.
Ashley Gulka. That's Gulka.
Correct.
Gulka. Hey, Sully, is this gonna catch it? No, I'm not. Okay, well, you know what? We'll put this obviously in the description box below. It'll be in the title as well. It'll be everywhere. So so Ashley Galka, and you said you have a website?
So it's the Facebook page, and
do you
then
have a
I'm on Instagram. No, I don't have a website.
No website.
Not yet.
Not yet.
Not yet. It's coming.
It is coming, and
It's
she doesn't have a website yet. But for now, you can find her on Instagram and you can find her on Facebook. And I highly recommend you go and see her because I have yet to meet a registered massage therapist that actually cares so much for their patients as to personalize their treatment, which I honestly, I'm not even just saying that because she's sitting beside me. I haven't met a RMT that actually does that. So that's really, really good. That's great. Any other way for them to get a hold of you besides social media?
Yeah, you can. There's a business number on the card that we can post as well.
Okay.
For people that are interested in booking, or if you have any questions.
Okay.
I'm more than happy to answer any types of questions.
Okay.
That people might have before booking. So yeah, definitely. They
Awesome.
can do that.
So you're reachable.
Yes,
Easily reachable.
I am reachable.
Okay.
I'm reachable.
Perfect. All right, great. Well, look, it was a fantastic, fantastic episode.
Yeah.
Thank you so much for being on.
Thank you so much for having me.
I learned a lot. I did.
Perfect.
And I'm sure a lot of people did as well. I know Sully did because he was paying attention the entire time. And if he's paying attention, that means it was good.
Okay.
So that's great. So thank you again. It was lovely.
Yeah,
thank you. So thank you guys for tuning in for another episode of Discover with Sbenati. It was an awesome episode. Tune in for another episode as we discover more.